Despite a plethora of conflicting data and opinions resulting in clickbait articles and clashes between bloggers of all kinds, you and I shall get the most of the results if we observe just 4 simple principles. Number 1. Make sure your calorie intake corresponds to your body weight and body composition goals. For example, if low body weight, low muscle mass, and frailty is all about you, then you should be aiming slight caloric surplus and sufficient amount of protein alongside your resistance training. If you need to reduce your body weight and body fat percentage, then deploy caloric restriction with aerobic and strength training to complement that, but make sure you still get your protein right. Number 2. Protein. We all know that it provides 4 calories of energy per gram. However, we consume protein primarily not as a source of energy, but as a structural component which builds different tissues of our body and fulfills a multitude of other functions. Notably, protein is mandatory to build one of the organs that determines our longevity and good metabolic health, namely the muscle. And for this purpose, protein must be sufficient and of high quality. Speaking of sufficient, the so-called recommended daily allowance of 0.8 grams per kilogram per day is in fact more of a minimal daily allowance, as it's not sufficient for an active, thriving individual or health optimization. Most recent studies suggest that the target of 1.2 or 1.6 grams per kilo per day is much more appropriate, and some prominent longevity experts often voice 1 gram per pound, which is around 2 grams per kilo per day, as the optimum. And the older we get, the more is the risk of anabolic resistance, which is the situation when our muscle becomes less sensitive and we need more protein for adequate muscle protein synthesis. Speaking of quality, make sure you feature a source of protein with a PDCAAS score of 0.9 or DIAS score of 100 or above with your every meal. It's also important to make sure that your protein sources in each meal contain at least 2.5 or better 3 grams of leucine, as exactly this amino acid triggers muscle protein synthesis. And lastly, in relation to protein, we must consume it in appropriate utilizable portions, which is 20 to 50 grams per meal. This way, we can expect optimal muscle protein synthesis. Number 3. Fiber. There are 2 kinds of fiber. Non-soluble fiber forms the bulk of our gut content and promotes regular bowel movements, whereas soluble fiber turns into a gel in our gut. And this gel, in its turn, does loads of wonders in the gut and around the body. On one hand, it creates a layer which slows down the absorption of different nutrients, for example, carbohydrates and cholesterol. This smoothens glucose and insulin peaks and reduces enterohepatic cholesterol recirculation. On the other hand, this soluble fiber gel provides a feeding substrate for our gut microbiome, which in turn, being grateful for such feed, releases short-chain fatty acids that are beneficial for our metabolic, cardiovascular, and gut health. General recommendation for adults is to consume 14 grams of fiber for every 1,000 calories, but the evidence suggests greater health benefits, lower risk of heart disease, stroke, type 2 diabetes, and bowel cancer at higher intakes of 30 to 45 grams per day. Good sources of fiber include whole grains, beans and legumes, fruits, and vegetables. And you can also use fiber supplements such as psyllium or acacia fiber by adding them to your porridge or protein shakes. And also remember that there is no fiber in animal food. Number 4. Nutritional composition. Favor whole and minimally processed foods over ultra-processed junk. And this will help you reduce the intake of added sugars, unhealthy trans fats, and empty calories, at the same time increasing nutrient density. By emphasizing whole foods, you naturally shall obtain more vitamins, minerals, fiber, antioxidants, and phytonutrients, all of which will support your metabolic, cardiovascular, and gut health at the lowest caloric cost. And as a bonus to these 4 nutritional tools, track your nutrition to determine if your intake of calories, macro and micronutrients is sufficient. You can do this as episodic snapshots of week or 2, just to check the status quo and calibrate your habits, or you can opt for daily, long-term tracking for more nuanced approach and sustained results. These 4 tools, along with tracking bonus, will reap you the most of the nutrition domain benefits, with fancy name diets being way secondary.